Hello, everyone. We are Echo Intelligent, a Taiwan-based startup specializing in AI-powered ultrasound technology. It's our great honor to be here today in the AI literacy course to introduce our devices and innovations. Echo Intelligent focuses on developing portable AI ultrasound imaging systems that enable real-time AI inference directly on handheld ultrasound devices. Our goal is to support clinical diagnosis and medical education through intelligent image analysis. At present, our system has been approved by the Taiwan FDA, TFDA, and our U.S. FDA application has already been submitted for review. We expect to receive U.S. FDA clearance in the second half of next year. The EchoVIU imaging system developed by Echo Intelligent features AI as its core innovation. By integrating advanced AI technology, EchoVIU aims to provide physicians and clinical professionals with effective diagnostic support and enhanced decision-making assistance. EchoVIU also offers a cart-based configuration, making it suitable for use in medical centers, teaching hospitals, regional hospitals, and even clinics. Its flexible design, which allows both stationary and portable operation, provides physicians and clinical staff with excellent mobility and convenience. This versatility makes EchoVIU especially valuable in remote or telemedicine settings, where it can greatly enhance access to quality medical imaging and diagnostic support. At the same time, EchoVIU offers a comprehensive selection of ultrasound probes, including convex, linear, cardiac, and endocavity transducers, enabling physicians and clinical professionals for various specialties to perform a wide range of ultrasound examinations. Furthermore, to provide greater flexibility and tailored solutions for clinical applications, EchoVIU is also developing customized probes based on the specific needs of physicians and healthcare professionals, delivering a more complete and adaptive ultrasound imaging solution. 36 seconds. The greatest advantage of EchoVIU lies in its portability and ability to perform real-time AI image inference. During ultrasound examinations, physicians and clinical professionals can connect EchoVIU with an AI-enabled PC to obtain instant AI-assisted imaging results. This allows clinicians to access diagnostic insights in real time, thereby accelerating the diagnostic process and enhancing the overall patient experience. In addition to providing real-time AI inference, EchoVIU also enables access to raw ultrasound radio frequency (RF) signals. This capability allows AI models to leverage not only ultrasound images, but also the underlying RF data, thereby enhancing model accuracy and diagnostic performance. Moreover, EchoVIU is equipped with a built-in rechargeable battery that supports up to 4 hours of continuous operation, making it highly adaptable for use in various clinical environments. Most importantly, EchoVIU is not limited to AI-exclusive functions. It also includes standard ultrasound imaging modes, such as B mode, CF mode, PD mode, PW mode, and M mode, providing clinicians with a comprehensive and fully functional ultrasound imaging system. The probes currently supported by EchoVIU cover a wide range of clinical applications, including abdominal, renal, obstetric/gynecologic, thyroid, breast, superficial tissue, musculoskeletal, carotid, and cardiac imaging. The system supports a frequency range from 1 MHz to 18 MHz, accommodating diverse diagnostic needs across different specialties. Among these, the LF9 probe stands out as a specialized design for musculoskeletal applications. It features a wide imaging field and supports dynamic measurement capabilities, making it particularly well-suited for real-time musculoskeletal assessments and motion analysis. To provide comprehensive AI ultrasound imaging support, Echo Intelligent has developed SUDA, a dedicated platform designed to help physicians and clinical professionals build their own ultrasound AI models. SUDA, short for Specialized Ultrasound Diagnostic Assistance, aims to enable users to create customized AI models with minimal technical barriers and seamlessly deploy them onto ultrasound imaging systems. Through this platform, clinicians can transform their expertise into practical AI tools, enhancing both diagnostic efficiency and clinical innovation. The development of AI models for medical ultrasound imaging often begins from the clinical perspective, where physicians and healthcare professionals serve as the key innovators. Many of the most valuable ideas arise directly from challenges encountered during routine clinical practice. That be why integrating AI-assisted solutions into these real-world clinical scenarios, physicians can gain effective diagnostic support for both decision-making and routine ultrasound procedures. For example, during an ultrasound examination, if the system can instantly provide AI-assisted diagnostic insights and highlight potential findings in real time, it can significantly improve diagnostic efficiency, reduce interpretation errors, and ultimately enhance patient care outcomes. In building an AI model for ultrasound imaging, the first and most critical step is data collection. Unlike other medical imaging modalities, such as CT or MRI, ultrasound imaging is highly operator-dependent. While CT and MRI scans produce standardized images without variation in scanning angles, ultrasound imaging relies heavily on the operator's skill and experience in selecting and capturing the correct imaging planes. Therefore, physicians and clinical professionals must acquire and record ultrasound images corresponding to the specific clinical task or AI model they wish to develop. These images should be collected using clinically relevant ultrasound parameters commonly applied in real-world practice. Such carefully curated data serve as the foundation for training and developing accurate and reliable ultrasound AI models. After completing data collection, physicians or clinical professionals need to annotate each collected ultrasound image. This involves marking the regions of interest, ROIs, that will be used as input for AI model training and assigning corresponding labels or descriptive annotations to those regions. Both the image data and the annotation information are then used as training inputs for the AI model, enabling the system to learn to identify and interpret similar patterns in future ultrasound images. The first two steps of AI model development, data collection and annotation, are typically areas where physicians and clinical professionals are highly skilled. However, the next stage, training and fine-tuning the AI model, requires programming knowledge and technical expertise, which often presents a significant barrier for many clinicians. To successfully build an AI model, physicians must have a solid understanding of Python programming, be able to organize and pre-process both collected and annotated data, and possess the ability to train the model. In addition, they need to understand and optimize various AI parameters to improve model performance. Because these tasks require specialized technical knowledge, the entry threshold for clinicians to independently develop AI models remains quite high. Once the AI model training is complete, the final critical step is to deploy the trained model onto the ultrasound imaging system. This integration allows the AI model to work directly with real-time ultrasound imaging, enabling physicians and clinical professionals to receive immediate AI-assisted inference results during scanning. For clinical practicality, especially given the unique characteristics of ultrasound imaging, it is essential that the deployed AI model can perform real-time inference directly on the ultrasound system. Only through this seamless integration can the AI truly assist clinicians in diagnosis, improve workflow efficiency, and enhance diagnostic accuracy at the point of care. For physicians and clinical professionals, when a clinical idea arises, the main challenge is not in collecting the required ultrasound images or performing image annotation. Instead, the greatest difficulty lies in the technical aspects, such as writing code, adjusting AI model parameters, and deploying the trained model onto clinical systems. As a result, it often takes 2 to 4 years for a clinical concept to be fully developed and implemented in real-world medical practice. Therefore, if we can simplify the technical and engineering requirements for physicians to build AI models, we can greatly accelerate the clinical adoption and real-world application of AI-powered ultrasound imaging. To address these challenges, Echo Intelligent developed the SUDA framework, a hardware-integrated platform that enables physicians and clinical professionals to directly perform image collection and data annotation on the system itself. SUDA supports several commonly used annotation methods, including bounding boxes, image segmentation, and key point labeling. To further enhance annotation efficiency, SUDA introduces an AI-assisted labeling assistant. After clinicians manually annotate approximately 300 to 500 images, SUDA automatically generates an AI helper capable of performing preliminary image annotations. Physicians or clinical staff can then review and refine these AI-generated labels. In other words, clinicians only need to invest time in manually labeling the first 300 to 500 images to train the AI labeling assistant. Afterward, the assistant can significantly reduce annotation time and greatly improve labeling efficiency, allowing medical experts to focus more on clinical insight rather than repetitive data preparation. All annotated images are then uploaded to the AI cloud computing platform for model training. Currently, SUDA supports major cloud services such as Microsoft Azure and Google Cloud Platform, GCP. It can also be integrated with in-house AI computing systems within hospitals or research institutions. Once the uploaded dataset reaches a sufficient volume, the cloud-based AI computation automatically initiates model training. After the training process is completed, the trained AI model weights are downloaded back to the EchoVIU system. Physicians can then switch to a dedicated testing mode on EchoVIU to evaluate and validate the trained model directly in real-time ultrasound imaging scenarios. In the following section, we will present 2 real-world case studies demonstrating how AI models can be developed through the SUDA platform, deployed onto the EchoVIU ultrasound system, and ultimately implemented in clinical practice as functional products. The first case focuses on fatty liver and liver fibrosis detection technology, developed using the EchoVIU 4L for liver system. 25 seconds. Metabolic dysfunction, associated steatotic liver disease, MASLD, has now become a major global lifestyle-related disease. According to World Health Organization, WHO, statistics, approximately 1.6 billion people worldwide are currently affected by fatty liver or MASLD, and this number is projected to double by 2040. In addition to the rising prevalence among adults, the incidence of fatty liver disease in children and adolescents has also been steadily increasing year by year, highlighting the urgent need for early detection and clinical management. 37 seconds. The progression of MASLD can generally be divided into several key stages: metabolic dysfunction, associated steatosis, MAS, metabolic dysfunction, associated steatohepatitis, MASH, fibrosis, cirrhosis, and finally hepatocellular carcinoma, HCC. The primary goal of detecting fatty liver or liver fibrosis is to determine whether the patient has entered an irreversible stage of the MASLD disease process. When MASLD is still in its reversible stages, MAS or early MASH, the condition can often be improved through diet and lifestyle management. However, once the disease progresses to irreversible stages such as advanced fibrosis or cirrhosis, medical intervention becomes necessary to slow down liver damage and prevent further deterioration. Currently, there are several clinical tools available for diagnosing MASLD, which can be broadly categorized into invasive and non-invasive methods. Among the invasive methods, blood tests and liver biopsies are considered the gold standard for diagnosis due to their high reliability and accuracy. However, these procedures are not ideal for pediatric or adolescent patients, as they are invasive and less well tolerated. For non-invasive approaches, MRI-based liver fat quantification is currently regarded as the gold standard, as it can directly measure the percentage of hepatic fat content. Despite its accuracy, MRI scanning is time-consuming, costly, and often impractical for young children or large-scale clinical screening. In the field of ultrasound-based diagnosis, the current standard techniques include shear wave elastography, SWE, and FibroScan. Numerous studies have validated these ultrasound methods as effective tools for assessing and diagnosing MASLD, providing a more accessible and patient-friendly alternative to MRI and biopsy. This product was developed through AI model training on the SUDA platform and has been commercialized as a specialized MASLD diagnostic mode. Using this feature, physicians and clinical professionals only need to scan the liver, press the freeze button, and adjust the ROI, region of interest, to perform localized assessments of hepatic steatosis and fibrosis. The software also allows clinicians to conduct multi-plane MASLD evaluations, minimizing errors that may arise from single-point measurements and ensuring a more comprehensive and reliable assessment of the patient's liver condition. The related technical findings have been published in international scientific journals, demonstrating the robustness and clinical value of the approach. The technology has been successfully applied to both adult and pediatric/adolescent populations for fatty liver quantification. In terms of performance, the system achieves an accuracy of approximately 85% in adults and up to 90% in pediatric patients, confirming its effectiveness across diverse age groups in non-invasive MASLD assessment. The second application focuses on automatic detection of hip joint angle abnormalities in infants under 6 months old. This AI-powered function eliminates the need for physicians to manually measure and calculate hip angles using conventional ultrasound methods. With this technology, clinicians can quickly and accurately obtain hip angle measurements, enabling efficient evaluation of normal and abnormal hip development in newborns and supporting early diagnosis of developmental dysplasia of the hip, DDH. Neonatal hip screening has become a global healthcare trend. While most countries currently adopt a selective screening approach, a growing number have moved toward universal screening programs. Early screening for hip joint abnormalities in newborns allows clinicians to detect developmental issues at an early stage, enabling timely intervention during infancy. This early detection significantly reduces treatment complications and improves overall treatment success rates, playing a crucial role in preventing long-term musculoskeletal disorders. There are several methods for screening neonatal hip joints, with the choice of method depending largely on the infant's age. Within the first 72 hours after birth, physicians or nurses typically perform a physical examination, visually assessing whether there are any obvious angular abnormalities in the infant's hips. Before 6 months of age, ultrasound imaging is the preferred screening tool, allowing clinicians to measure hip joint angles safely and accurately without radiation exposure. After 6 months, once the femoral head begins to ossify, X-ray or MRI is generally used for evaluation. Since the success rate of treatment decreases with age, most national pediatric health guidelines recommend completing diagnosis and initiating treatment within the first 6 months of life to achieve the best possible therapeutic outcomes. This AI model was developed using keypoint detection technology on the SUDA platform. When the physician scans the neonatal hip joint and presses the freeze button, the AI model automatically detects the hip joint position within 1 second and calculates the corresponding hip angle. The system then provides this information instantly to assist physicians in evaluating and diagnosing hip joint abnormalities in newborns. First, let us demonstrate the SUDA platform. The screen shown here features SUDA's annotation tool, which allows physicians and clinical professionals to create new projects after completing ultrasound image collection. In this demonstration, we use image segmentation as an example with ultrasound images of the bladder. Once a project is created, clinicians can use SUDA's tools to annotate images directly. For the bladder example, the segmentation tool is used to outline irregular structures. To simplify this process, SUDA adopts a multi-point segmentation approach, allowing precise marking of complex shapes. After annotation, users can fine-tune individual points and upload the final annotations to the cloud. When 300 to 500 images have been annotated, SUDA automatically generates an AI-assisted labeling tool, which begins to perform automatic annotations. Clinicians then only need to review and confirm the AI-generated results before uploading them, greatly improving annotation efficiency. Once the AI model training is completed, users can download the trained model weights directly from the top right corner of the SUDA interface and deploy them into the EchoVIU software. In the intelligent mode, the corresponding AI model becomes available for real-time use. Here, we demonstrate a real-time hand tendon and bone detection model. Through the SUDA platform, physicians and clinical professionals can develop customized AI models and test them directly in clinical applications, turning their own ideas into practical AI-powered ultrasound solutions. The EchoVIU 4L for liver system is designed for simple and intuitive operation. Physicians perform the scan just like a standard liver ultrasound examination by imaging the liver, pressing the freeze button, and selecting the region of interest, ROI. The system then automatically calculates the UFF score, which is used to evaluate the risk of fatty liver and liver fibrosis. To ensure diagnostic accuracy, physicians can measure UFF scores from up to 5 different scanning planes or locations and calculate the average value, providing a more objective and reliable assessment of hepatic steatosis and fibrosis. In routine clinical practice, physicians typically perform neonatal hip joint scans using a standard ultrasound imaging system. After capturing the images, they use the system's manual measurement tools to determine the hip angles and then input the results into the hospital's reporting system to generate a diagnostic report. This entire process usually takes 15 to 20 minutes per patient. With the integration of AI technology, this workflow has been dramatically streamlined. The AI-assisted system can complete hip angle detection in just 10 seconds per leg, allowing a full bilateral scan to be finished in under 1 minute. This advancement significantly reduces clinical scanning time and greatly enhances diagnostic efficiency for both hospitals and physicians. Our final demonstration showcases real-time AI inference on ultrasound. The current pipeline achieves up to 15 frames per second on CPU and up to 40 frames per second on NPU, with support for both x86 and ARM architectures. Together, EchoVIU and SUDA provide an ideal platform for clinicians to develop, deploy, and iterate on custom ultrasound AI models at the point of care. Thank you for your attention. If you have any questions or would like to learn more, please contact us at Matisse at echo-int.com.